Grady EMS to our trauma center. At the present time, one is still in the operating room. The other patient is coming out of the operating room. We have one patient who had a procedure in interventional radiology, which was completed. They will have additional studies done, and one patient remains stable in the trauma center.
Can you explain what interventional radiology means further?
Sure. Certainly have certain types of injuries, particularly vascular injuries. Sometimes we're able to go to radiology rather than the operating room to repair that injury or take care of it. So it's still an invasive procedure. It's usually done under anesthesia, but it is in a different area of the hospital, not in the main operating room.
Earlier today, you
can you repeat the condition of 4 people that were brought in?
Sure. So we had 4 people brought in by EMS. Of those, one is still in the operating room, probably the most seriously injured. Another patient just got out of the operating room and is doing well. We had a third patient who had a procedure in interventional radiology, and they will have to have additional procedures to follow up. And then the final patient is still in the trauma center, probably does not require surgery and is doing well.
Were they shot multiple times? Can you talk about where and how they were shot?
Well, I don't know how many times each one was shot. Really because of patient confidentiality, I don't want to get into the nature of the wounds. I think that would be a little unusual.
Were any of these cases particularly challenging for the surgeons?
Well, 2 of them were particularly serious, the ones that went to the operating room. And the one in the interventional radiology was in critical condition too. So all 3 of those are very serious injuries.
And can you once again describe what would make you go to the interventional radiology versus the regular trauma area?
If it is primarily an injury to the blood vessels, we're frequently able to take care of that in interventional radiology as opposed to having to open the patient up in an operating room. Interventional radiology is where you go in through the blood vessels using special catheters and are able to take care of the injury that way.
Can you talk about the flow of patients, maybe not specifically with this case, but the flow of patients coming into the ED and then moving throughout the hospital to ORs and other places?
Right. So in this particular case, as I said, Grady EMS brought all 4 patients here. They arrived within 20-30 minutes of each other. We were already prepared in the trauma center. We had trauma surgeons, nurses, all the staff ready. So as soon as they came into the trauma center, they were put into a trauma room and were treated immediately. 2 of those were taken immediately up to the operating room. We had the operating rooms open and ready, so they went directly from the emergency department to the operating room. The other one went straight from the emergency room to the interventional radiology suite. None of them were delayed by more than any time at all because we were ready for them immediately.
For the patient who's still in the operating room, how long has that surgery been going on?
It's been going on a number of hours. I don't know, it's probably about 3 or 4 hours.
Were all 4 of them shot? Their injuries were all gunshot?
Yes, they were all gunshot wounds.
And you mentioned earlier this afternoon that there were at least 2 families here. Have 4
Yes.
families arrived?
I haven't checked back to the emergency department to see. Hopefully they have arrived.
So it's fair to say 3 are still in critical condition.
Pardon?
3 are still in critical condition.
Yes.
And the 4th, 3 are in critical,
The 4th is stable.
stable.
Can you talk about the next steps, what these next few hours look like for the medical teams taking care of them?
So obviously we've got to finish the surgery on the one patient who's still in the operating room. They will go to the surgery intensive care unit. The other patient who finished surgery will go to the intensive care unit. The one who went to the interventional radiology suite is in the intensive care unit. So all 3 of those are either in the intensive care unit or will be going there afterwards because they are still critically ill. They will be treated by the trauma surgeons who staff the critical care units.
And you said earlier that you were totally prepared for this. Did everything go smoothly from the hospital then and things as far as responding?
It went incredibly smoothly, and I cannot be more proud of the performance of all of the staff at Grady. From the surgeons, we had EVS ready, so we had everyone there. We had chaplains ready to deal with the patients and their families. So By the time they arrived, we were fully staffed. We had empty rooms waiting. It was absolutely seamless. I cannot be more proud of the way Grady handled this.
Thank you guys. That's it for now. We'll keep you updated.